Hi, I'm Beth Noel, the Director of Behavioral Health at NorthShore, and you are watching Ask the Experts. Eating disorders are serious mental health conditions, not choices or phases. They involve ongoing disturbances in eating behaviors, thoughts, and emotions related to food, weight, or body image. According to diagnostic standards, eating disorders can significantly impact physical health, mental health, and daily functioning. They affect people of all sizes, genders, body sizes, and backgrounds. Some of the most common eating disorders include anorexia nervosa, which involves severe restriction of food intake, an intense fear of weight gain, and a distorted view of body size or shape. Bulimia nervosa, which includes cycles of binge eating followed by behaviors such as vomiting, laxative use, fasting, or excessive exercise. Binge eating disorder, which involves repeated binge eating episodes without purging behaviors. This is the most common eating disorder in the United States. Other conditions like avoidant or restrictive food intake disorder, or OSFED, are also common but often overlooked. Eating disorders don't always look the same. Some common warning signs include preoccupation with food, calories, weight, or body image, skipping meals or following rigid food rules, eating in secret or avoiding meals with others, frequent bathroom use after eating, fatigue, dizziness, or gastrointestinal issues, mood changes, anxiety, irritability, or social withdrawal. It's important to know that someone does not need to be underweight to have a serious eating disorder. Eating disorders can affect nearly every system in the body. This includes heart rhythm problems, electrolyte imbalances, gastrointestinal damage, bone loss, hormonal disruption, and even fertility concerns. They are also associated with higher risks of depression, anxiety, and suicide. Anorexia nervosa in particular has one of the highest mortality rates of any psychiatric disorder. There are many myths about eating disorders. They are not about vanity. They do not only affect teenage girls, and they are not a sign of weakness or lack of willpower. Eating disorders are complex medical and psychological conditions, influenced by genetics, trauma, environment, and culture. If you're concerned about someone, approach them with compassion, not judgment. Focus on health and well-being, not appearance. Avoid trying to control their eating. Encourage professional help. And understand that recovery often takes time and support. Early intervention leads to better outcomes. Treatment is most effective when it involves a multidisciplinary team. This may include therapy, medical monitoring, nutritional supports with a registered dietitian, and psychiatric care. Levels of care range from outpatient therapy to intensive outpatient programs, partial hospitalization, residential treatment, or inpatient care, depending on severity. Recovery is possible, and evidence-based treatment saves lives. If you or someone you love may be struggling with an eating disorder, help is available. You are not alone, and support can make a difference. Thank you for being part of this important conversation.